Just a few short years ago, you'd likely never even heard of GLP-1 medications. Today, they're on the tip of everyone's tongue as the solution to weight management, has long-standing organizations like Weight Watchers on the verge of bankruptcy, and is making employee benefits coverage for employers more difficult than ever due to the cost. How do they work? Why are so many people talking about them? What are the potential dangers? And are there safe, smart ways to proceed down this path? We are extremely fortunate today to have physician Dr. Sheri Poznanovic and nationally board-certified health and wellness coach Erin Chain join us on today's episode of the Coaching Lab podcast. Dr. Poznanovic is triple board-certified in nutrition, lifestyle, and obesity medicine. After more than 15 years as a practicing pediatric ENT surgeon in Colorado, her career focus shifted to lifestyle, wellness, and nutrition counseling. She also has a Master of Science degree in nutrition and human performance and has had her work published in peer-reviewed journals. She is the founder of Optin Health Nutrition, a comprehensive nutrition and lifestyle medicine practice in Colorado. Erin Chain is a physical therapist and nationally board-certified health and wellness coach. She works with Dr. Poz on the lifestyle management side of the equation and brings an exceptional background to the table. I've known Erin for years through her work with Catalyst Coaching, and she gets 100% of the credit for making this interview a reality. So thank you, Erin. Thank you for making the Coaching Lab podcast a regular part of your week. I'm honored to be your host, Dr. Brad Cooper of Catalyst Coaching. As I mentioned, we've been working on this interview a very long time because it is so critically important to the discussion happening in today's world. If you're an employer or EAP who's tired of generic coaching for employees, Catalyst Coaching 360 has been the best-in-class provider since 2007. You can now access a range of specialty coaching options, including tobacco cessation, lifestyle support to complement the use of GLP-1 meds, as well as our Catalyst Elite Resilience and Mental Toughness coaching for executives and high performers. All the details, catalystcoaching360.com, or reach out with questions anytime. Results at catalystcoaching360.com. And now, it's time to tap into the wisdom of Dr. Poz and the one and only Erin Chain on the latest episode of the Coaching Lab podcast. Dr. Poz, Erin, thank you so much for joining us. We have been working on this interview for, I don't even know, 6 months, something like that. It's such a critical topic. I love the way you're approaching it. There's so much to talk about today. Welcome to the Catalyst 360 podcast.
Yeah, thanks for inviting us. We're excited to be here.
Get us started. I first heard about GLP-1s, 3 or 4 years ago in a weird setting. I was at a tailgate down south, and it was not in the context of how you're handling it. It was more people using it that maybe questionable uses, but that's where I first started hearing about it. Why did it pop onto the scene all of a sudden? Where did this research develop from? Just kind of give us some background into where this all came from and why it seemed to be so suddenly hitting the real world.
Yeah, so GLPs have been around for a while, actually. I think Saxenda was originally approved for weight loss in 2014. So, but they all were originally designed for diabetes because they control glucose metabolism. So they originally were treating for that. And the original studies based off of that, obviously they found that people were losing vast amounts of weight. So intelligently, the pharmaceutical company said, maybe we should fast track this weight loss. And that's kind of where it popped onto the scene for weight loss. I think when they first came out, unfortunately, it was, as you described, like it was used in inappropriate settings and still is to this day in settings and in people that maybe don't necessarily need GLP-1s. And so it also has caused like shortage issues and major issues with insurance coverage because of how it's popped onto the scene in such a mass production standpoint of people desiring these medications. But they originally were designed for diabetes and then obviously popped over into weight. And now there's more and more studies looking at other areas of how they may improve cardiovascular disease, renal disease, liver disease, autoimmune disorders. Like there's so many other things that we're finding the GLP-1s may improve with, that those studies are also ongoing too.
Neurodegenerative disease too.
Yeah, absolutely.
You said so much in there. The shortages, let's touch on that first. There's shortages, and yet we're seeing Instagram advertising this, without all the support that you're offering, without the lifestyle support that's critical, and we can get into that later on, but are those fake? Is that the real thing? Where is that playing a role in the shortages? And I know you don't know the answer to all of this, but just in terms of your thoughts or what the two of you are seeing.
Yeah. So, I mean, a lot of the stuff that you see pop up on Instagram from different compounding pharmacies, most of those obviously are not the brand names, and they're not designed by Lilly and the other pharmaceutical companies. So they technically are not FDA approved. That being said, compounded medications have existed for a long time, and there's nothing wrong with compounded medications. And there is a role for them in the site and scope of when things are in shortage. Unfortunately, that usually is defined by the FDA, and there's an actual list that FDA has for medications that are on shortage. And even if there are time periods where I feel like some of our medications are in shortage and I can't get it in pharmacies, it may not pop up on the FDA list. So some of those medications, and every pharmacy is different, and there are tons of different compound pharmacies out there. You really have to vet that pharmacy, especially from a physician standpoint, the person prescribing it, whether it's a clinical pharmacist, whether it's a physician or any type of provider. And for you as a patient, what are you actually getting? Because some of them aren't. Some of them are salt-based of these medications, which have never been studied, never been shown to have any efficacy to them. And there's more side effects with those. A lot of them also will contain other things. That's how they kind of get around the loop with the fact that they're creating a medication that's already patented. So you also need to know what's in it. And then you also need to just vet the pharmacy, the safety of it, the protocols that are in the pharmacy. There's so many things that you need to look at if you even consider using compounded medications. It's a big discussion in the obesity medicine world itself. The OMA actually just recently came out with a statement sort of adjusting their consensus on compounded medications because so many people are using them and they do exist. They are not for or against them. They do say use them when they are technically in shortage, but again, from a physician standpoint, they put out an entire checklist of what do you need to find in a pharmacy to show that these are the medications that are safe to use in your patient if you're going to use them.
Okay. And let's just take a step back. In layman's terms, what is this doing? It seems so effective in the right setting when utilized correctly. What's going on behind the scenes in a way that we can all understand?
Yeah. So GLP is the satiety hormone. So it's released normally when you eat from your intestine. So, and in general, any macronutrient will cause the release of GLP-1, but protein in particular, fiber, like those are two big things that really produce GLP-1. It releases, and it does several things. One, it controls glucose metabolism. So hence the reason they originally came out for diabetes. It causes the secretion of insulin from the pancreas, which is going to lower that blood sugar rise that you have as soon as you eat something. It's going to help you store that sugar. It stops the secretion of glucagon, which is kind of the counteractive mechanism against insulin. Glucagon is released when insulin levels are low and when you need your blood sugar levels to rise. So it stops glucagon from producing and releasing stored sugars that you have like in your liver and muscle and other locations. That's part of it. It also slows down the emptying of your stomach to make you feel more full. And then it works on the brain. So it works on the brain in the fact that not only does it have an anti-satiety effect in the hypothalamus of the brain, but it also has some role in the reward system. There are so many hormones that control hunger in general. The satiety hormones that we address with medications are only part of it, right? Like there's the reward system and dopamine, and that is a huge component as well. It doesn't necessarily work on dopamine, but it does work on that reward system to kind of help decrease that desire for food. So you'll have people describe that the noise for food that they have, like that desire to want to eat, to always think about food, is kind of gone. And a lot of that is kind of playing into that reward system in the brain. The other medication that's out there besides GLP-1, current medication is medication from Mounjaro that found two different ones. Both of those are tirzepatide. Tirzepatide is a combination of a GLP-1 as well as GIP, which is another satiety hormone. So it's sort of doubling up all those effects. Hence the reason we've seen even better results with those medications. And they are, as you said, phenomenally effective. They do decrease appetite. They do decrease and increase satiety. So the downside of that is sometimes a little too much. So if you're getting these not by someone who is monitoring you closely, I've seen people that have like cut their calories back to the point that they're endangering themselves, like too low of a calorie content because they're not hungry. They don't want to eat. And so that needs to be monitored, and you need to ensure that people are actually getting in the actual nutrients that they need to have with these medications.
And I'd like to slide over to Erin on this one, because that's my biggest concern is I see people who don't have the support you're offering, and thus they're so excited about the weight loss. It's taken so many years, and they're just like, bring it on. Like, yeah. And in the process, there are, I'm going to use the word no, but obviously limited macronutrients, limited micronutrients. That feels great in the short run, but 10 years down the road, 5 years down the road, 30 years down the road, I'm just seeing this disaster of, okay, I don't weigh anything, but I also have not been feeding all of the organs and joints and ligaments and everything else that I need for brain health, for cognitive effectiveness, for activity levels, et cetera. Erin, how are you having that conversation when I'm guessing they're so excited to simply have lost 10 pounds, 20 pounds, whatever it is? They're like, yeah, whatever, coach, but I'm just psyched. What do you do with that?
Yeah, no, you're hitting the nail on the head. There's no quick fix, number one. And obesity, as we know, is a complex, multifaceted disease that needs a multidisciplinary team, and Optin provides that. We do not have someone come in the door and immediately give them medicine. It is a process we take on an individual basis with each client and patient we serve. We also have a pharmacist as well as a dietitian that's also a chef. So it is very thoughtful from that first meeting. It is not, we are not giving Zepbound and, we'll go be Ozempic day one. It is a long process. Each patient has the opportunity for 8 coaching sessions. My first session is, what is your why and what is your outlook for yourself and your holistic wellness? Each patient is different. Being a coach in this population is extremely challenging and extremely, extremely rewarding. But we are in constant battle with those quick fixes. So my job is not at all easy, but it is very, very much loved.
And I know you as a coach. We've worked with you in a different setting for years. I know you're an outstanding coach. What have you learned since stepping into this role that added to your already, you are very good. And you're saying you've learned as you went. What are some of the things that you learned in this setting that maybe you weren't drawing on in your other settings?
Ooh, that's good. I love being part of a team. I love the teams I work with within my coaching world and with my teams here at Optin and other teams I've been fortunate to work with. My favorite team is my partnership with weight loss patients. I am constantly amazed at the mental toughness, the grit, the resiliency they've had, because many of them have been through traumas. Many of them are on a daily basis trying to make those choices when they're challenged in their work, in their relationships, in their families, to stay on the right track with the right coping tools. But food is their coping, and to change that and to have support in that and to develop that mental toughness to stay the road in behavior change is, again, my greatest challenge and my greatest reward in being in partnership with my client.
Yeah, Brad, and along those lines, that I think is incredibly effective of making sure you're working with the multifaceted disciplinary clinic when it comes to weight loss and having a wellness coach on board. As Erin said, the majority of patients that struggle with their weight will have a history of trauma in their past, and that their coping mechanism has become eating. And if you are taking that away with the medications, there's a lot that has to be worked through with that. And I think there's a component that Erin works with a tremendous amount. And then there's, at some point from a wellness coach standpoint, that you have to say, maybe this person needs a little bit more help than me, right? Because there's a large, I'd say 70 to 80% of people have a history of some sort of trauma. So just recognizing that. And if you're someone that's going and getting a medication from your gym or from a pharmacy and there's no one helping you with that, there's going to be a huge problem with that. If you all of a sudden no longer have that coping skill to get past your issues, whether from the past or current.
Mm-hmm. And that adding on to what Dr. Paz is saying, my skills in defining my scope of practice, in encouraging more mental health support with professionals that are licensed in this area, have increased dramatically in this population. But you have to hold on to them, because if you lose them, they will find things that aren't accredited or based on best practice. And it just breaks my heart when that happens. So the wording I've used, the wording my team has helped support the patients with to stay within our scope, help them have self-awareness, encourage a licensed practitioner that can support them in mental health challenges, has been a big area of growth over the past few years.
Let's talk red flags. So somebody's listening to this, or they've been thinking about this for a while, and they're like, okay, I'm ready to move forward. I'm not anywhere near Colorado, so I can't go see Dr. Paz, but I'm going to look into this. What would be some red flags? Let's look at the things that should make them go, oh, nope, that's not the right choice for me. As they're looking at options out there for them that are legitimate options, what are some of the red flags to be aware of?
I would say the biggest thing is if it's just you're getting the medication with no support or help at all, which you can get that. I mean, I know people that literally can go to their gym and get needles and the medication, and is prescribed by a provider that's there, and they never even see the provider, or they see the provider once and that's it.
Right.
That should be a huge red flag. I get the desire of it and the ease of getting the medication, but I also liken it to the fact that, like, would you get your high blood pressure medications from a gym with nobody monitoring you, right? You wouldn't. Like, no one would do that. And you shouldn't treat these medications that way too, because they're real medications. They have real side effects.
Great example.
They should be followed by people. That would be a major red flag for me.
Okay, good. Others, anything else? Or Erin, anything that pops into your head?
If a patient or client doesn't really want to know the why or discuss their why, I don't know that they're a fit for us, because they're looking for a quick fix, and they'll find it cheaper and not do the research to make sure they're safe.
And I would say also, if you're going to a program that doesn't have lifestyle modifications with it, if you look at all the studies that originally came out with GLP-1 medications for weight loss, all of them were the medication combined with intensive lifestyle changes. That's where you see the changes, and that's where sustainable change happens, right? People can go on these medications, they may come off 3 months later. If they haven't made any of those changes, all that weight is going to come back on. So I think if you're going to a program that's not offering those things, I'd be hesitant about that.
All right, so
you need to learn how to re-eat. You need to learn to exercise. Like, there's so many components of weight loss besides just the medication.
So you mentioned the coming off. Many insurance companies don't currently pay for this. We'll see if that changes over time. So many people paying for this out of pocket, saying, I'm going to do this for X number of months, and then I'll step back. How effective have you seen that strategy to be if they're doing the things that you're talking about? And B, I don't know. It's just, this is the world we live in, is behavior change, and behavior change is just stinking hard. How many times do you see the people that they come in saying, yeah, here's my plan, but life hits, and so they're right back 6 months later. Walk us through some of those patterns with the repeat or the desire to step away from it and have that be effective.
Yeah, so I would say if you look at all the limited long-term studies that we have so far of using these medications in weight loss, even with lifestyle changes, most people put weight back on because of all those reasons that you just said, right? Like life does happen. And obesity it's not just willpower, right? Like we know that. It's not just calories in, it's not just calories out. It's not just willpower, you're lazy, you're weak, that's why you're gaining weight. There's so much more to it. It's a complex disease. And with a complex disease, you need to appreciate that sometimes that medication needs to be long-term, if not lifetime. So if you look at the stance in the OMA as of right now, these medications should be used lifelong. Very similar to like being on a high blood pressure medication. Just because you made your blood pressure better by being on a medication doesn't mean you should come off it. All of that being said, we have a handful of patients that have made lifestyle changes, that have been on these medications for a year, 2 years, that have either come off or slowly wean to, say, every other week dosing of shots or once a month, and are doing well. So I think it's an individual-based approach. Like I think you need to approach your patient and knowing, is this someone that I feel that is going to be able to sustain? And if you're saying that it's not going to happen, like go back on the medication. So I think that area is still kind of gray, even though the stance is, you need to be on it forever. I think it's still great to know exactly where that is. And every individual is going to be a little different.
And in our team, we can really see that coming, because if they're wanting to do a trial of lessening their dose or going every 2 weeks versus every 1 week, we practice preparing. We practice those, what is that going to look like for you? So that then when they're in that moment, using the functional mental toughness model, and they have to activate and use those new lifestyle changes and put those new habits into a test mode, that's readily available to them as they're challenged into the real world.
Interesting. So Erin, patterns, everyone's unique, everyone's individual. So you're approaching each of these clients as an individual with their specific lifestyle changes, but are you seeing patterns? Is it leaning more into the automating the exercise elements? Is it more around let's create, again, I'll use the word automation with breakfast and lunch choices? Are you seeing things that as coaches that are listening that may be stepping into this type of a role, types of patterns that you're seeing be most valuable initially?
Yes. And jump in too, but if there's a connection piece, if these people, if these patients we're serving are in need of connection and aren't having it through the process of coaching, that is we can predict with pretty good, we can predict pretty well how successful they will be coming off the medicine.
Interesting.
Connection is huge in that thrive component when we're coaching them towards a change of getting off the drug and maintaining new habits. That's probably my biggest one. Even bigger than, nutritional guidance, physical wellness, it's that connection piece because of the 80% of them having a trauma history and struggling with connection.
That is so interesting. Because you and I talk about the cornerstones: move, fuel, rest, connect. And had you made me guess, I would have put that one last. And you said, no, Brad, that. And you all can't see it. We're looking at each other on screen. She was looking at Sheri, and Sheri's nodding her head. Yep. That's exactly right. That is so interesting. So the connection piece, that's a great lesson for all of us. So Dr. Poz, you've been doing this for a long time. Before GLPs popped onto the scene, was that a pattern? Has that always been a pattern? Was the connection piece always risen to the top in terms of those aspects?
Oh, absolutely. And not even necessarily even just from history of trauma in the past, but just what you're influenced by and what you're around, right? If you look at data of people that are overweight, if someone is overweight or obese, the majority, 60 to 7% of their friends are also overweight and obese. People who hang out with people that aren't overweight or obese tend to be less likely for that. So it's having that support as well too. And the downside of that is there also was a study that came out that people that were trying to lose weight together. So it was looking at women who were trying to lose weight together. Unfortunately, if it was two women that were similar weight trying to lose weight together, it almost created more of a competition between the two, and it had negative effects. Versus if you have a support system of someone who isn't trying to lose weight, right? Like someone who is already healthy, like at it, and they're your support system, that's actually a better goal to have than trying, even though it's always great to have somebody that's in that role with you. It's great to have somebody that isn't, to get rid of that competition component of it. And that happens, right? Like we see that in couples, and we have that, like we'll see the husband or the wife, and then all of a sudden the other one comes in, right? Because they're seeing these great benefits from the other one. Interestingly, when these medications came on the scene and we were seeing like tremendous amounts of weight loss, the rates of divorce in married couples, that one lost a tremendous amount of weight and the other didn't, actually went up.
Wow. Different life.
Yeah.
Interesting.
And that connection, when they don't have it, guess what they connect right back with?
Right.
Their relationship with food. And that is the biggest piece.
Yeah. If you look at like the data that was out before GLP-1s were like a big thing, like people who have lost weight and maintained losing weight, the things that really mattered were the things that we talked about. One, that they changed their dietary habits. Most of those people change their dietary habits. Most of those people eat breakfast. Most of those people work out over an hour a day. So when it comes to physical activity, the importance of physical activity weight loss is the maintenance of weight loss. It's not necessarily the standpoint of losing weight. It's really hard to lose weight alone with just physical activity, especially the older we get. But to maintain it, you have to keep that in there as well. Those are the things that we see in people that have maintained weight loss long term.
Well, and that just ties in. Yeah, absolutely. And that also connects to all the things we talk about with strength training in older age with, yes, great. Maybe it's not creating weight loss, but it's helping you get up from the floor when you fall. It's allowing you to lift your grandchild up. It's allowing you to put that suitcase up above your airport or your airline's compartment. So two things that you talked about that just popped off the page, the rule of 5 people that we've known for years. It doesn't matter the topic: finances, education, eating patterns, exercise habits, spiritual life, etc. You become the 5 people you spend the most time with. We know that. And it's interesting that is absolutely true in what you're talking about. And then the spousal or the friend component, it reminded me of the AA sponsor. You go through the group with other people in your same situation, but your sponsor's not. Your sponsor's been away from alcohol or addiction for whatever, 9 months, 5 years, 3 years, whatever. So it sounds like it's the same pattern.
Yeah, that's a great analogy.
Interesting.
Yeah, actually.
Interesting. Yeah. Could you share a case where combining the GLPs, we'll keep it anonymous, but combining GLP-1 therapies with lifestyle changes, it was one of those successes, one of those where you just look back and you smile. And what role did each part play in that outcome?
Oh, how do we pick just one?
And you can genericize this. You can, if you want to genericize it and say, in general, here's kind of what we see. Whatever's easier, because absolutely, in your role, you're seeing this all the time.
Yeah, I think the standpoint of watching people lose weight, like the gratifying component of it, is is like people feel so much better about themselves, right? Like that level of confidence goes up, and that is from a standpoint of as a provider, that's such a good feeling to get of someone coming in saying like, you've changed my life. And unfortunately, like losing weight is like a huge component. Like our body image is a huge part of our life. And so when people feel better, it is a gratifying feeling for a provider to get that. And to also have them come in and say, I feel so much better because I've changed my diet, right? Like I've changed my diet, less inflammatory. I've lost weight. My arthritis is better. Like my autoimmune symptoms are better.
Yeah.
Like my blood pressure went down and I came off my blood pressure medication. Like all of those things are incredibly gratifying to see as people like spread through the process of doing this and losing weight, and the fact when they maintain over the long term. I've had an older person, similar sort of thing, like her main goal was, I want to be able to be around my grandkids and I need to lose weight. Lost like 60 pounds, joined silver sneakers, has a totally different body image from where she used to be and has maintained that weight loss, and dietary habits have changed and is happy in a better place and is able to walk around everywhere with her grandkids. Like just went to Europe and, walked around Greece all over the place, which she wouldn't have done before she lost the weight that she lost.
And going back to the first time we meet with them and what is your why, hearing them not only hit their why to be able to play with their grandkids, to go travel and walk through Europe, to get back to their favorite hobby and then flourish in those new hobbies. It's like they're back to them. And that just, it's so great to see. And then they're confident, they have self-compassion again for themselves, and they're them.
And it's easier to connect with people when you feel good about yourself and you're not looking for somebody to lift you up all the time or tell you you're okay all the time. So this is getting me thinking of a different route I hadn't planned to ask you about, but we do something called Catalyst Care, which is a pre and post surgical coaching, helps people kind of prepare for surgery and then after surgery is over. And then we just had Dr. Luke's on, an orthopedic surgeon, talking about joint replacements and all that's involved with that and when maybe not to do it, when to wait. And then yesterday I read in the Wall Street Journal that joint replacements in the 45 to 64 or 40 to 60 range. Anyway, the younger population for that component has gone up 217%. Are you seeing, or are you expecting to see that, like, we're hoping orthopedists, insurance companies start having them use coaching pre and post surgery, but I'm thinking take it even further. Are you seeing them or expecting to see them say, okay, yeah, it might make sense to pursue a joint replacement, hip, knee, whatever, in 6-8 months. But prior to that, I want you to get in to see Dr. Poz, because this is going to really help you post-surgically. It's going to really help. Are you hearing that yet? Are you expecting it to go that way? It just seems like a natural flow.
Yeah, I think we are. I mean, there are some limitations, and I've had orthopedic surgeons that have said, I won't operate on you till you lose weight. Mm-hmm. Because of anesthetic risk right. of surgery. Right. Like, there's so many reasons, right? And I've had a few of those approach me because they need to lose weight before surgery. So I hope that translates into a large portion of this population, right? Because especially with an arthritis standpoint, like the more you lose weight, the arthritis in general tends to feel better. And if you do lose weight and you're feeling better, maybe we avoid for a period of time getting that replacement.
Yeah. Oh, absolutely.
And so I hope that business becomes bigger. The main ones I've seen so far of like, you have to, like, you're an anesthetic risk. We can't operate on you until you have lost some weight and you're healthier, right? Your blood pressure needs to come down, like things need to get better beforehand.
Well, I'm even seeing the insurance companies wanting them to see you first, because while you're not inexpensive compared to a total hip, you sure are. So if I've got a 62-year-old, if I'm an insurance company, I've got a 62-year-old that's got a bad hip that's been going on for not 5 years, but a year, 6 months, 8 months. Oh my word, there's a great chance that working with you is going to reduce the need for that, not indefinitely, but for 7-8 years.
Yeah, I think the other component of that too is the more people lose weight, the more they're willing to do physical activity, right? Yeah. The more comfortable they are to go out. And as you know, increasing your physical activity, strengthening your muscles, strengthening your bones, that potentially
reduces arthritis
better too. Oh. Exactly. So combining those two things together, right? Absolutely.
So you're not seeing it yet, but you kind of sort of expect to see it.
We are a bit with the sleep apnea and the fact that surgical opportunities for patients that are discerning and where they want their surgery. Some outpatient surgery centers do not take patients with sleep apnea or a BMI over 36, 40, I think, and they have to go to the hospital, which has higher fees if they have a high deductible, et cetera, et cetera. So I think we see it and are referred a lot for sleep apnea patients, not as much total joints yet, but absolutely it all is connected and would serve them the best if more did come our way that way.
It's also, I mean, along those same lines, like I think every patient, especially from an orthopedic surgery standpoint, should be referred to nutrition before pre and post,
100%.
just from a recovery standpoint.
Yeah.
And I think all of that goes along the same line.
Trying to think how to ask this question. Someone's listening. They have accessed GLP-1s through one of the areas that you've suggested, maybe not the wisest, but they're already in. And they could contact Erin or a credible, a nationally board certified health and wellness coach, not an Instagram and wellness coach, everyone. But
thank you, Brad.
yeah. Hello. Do your homework, everyone. But what would you suggest to that person? Well, let's say outside of a coach. So they're not going to access a coach. They've got they're buying them in the back alley or on Instagram or whatever, and they're losing some weight, but they hear you and they're saying, yeah, for long term, I want to make some positive lifestyle changes. What steps would you recommend for that person if you could whisper in their ear, Erin?
I'd say you're worth more than that. Excellent.
And they say, I know, but I don't make more than that. So, then what?
We are both as professionals, as is everyone in our team, more than willing to have a free 15-minute talk to see if that opens up their gateways in their mind of the opportunity they have for more support.
Yeah. And I'm also hearing, don't miss the connection piece, folks. Like that. That's my big eye opener for today is, wow. Like I thought, oh, well, you need to be exercising. Oh, well, you need to watch what you're eating. Oh, well, you need to watch your sleep because that affects the other two things. And you're saying, yeah, those all matter, but connection first.
Mm-hmm.
That is
and
so
they see
powerful.
all that on those Instagrams they're watching. I mean, every second there's something about sleeping better, moving better, working out better. But the harder thing to get to is how do we connect with who we are and what we want in 1 month, 3 months, 1 year, and what does that look like for each person? Because it's individualized and they deserve it.
Yeah. Erin, you've mentioned a couple of times functional mental toughness. Obviously, I know where you're coming from on that, but for our listeners, can you talk through a little bit more about what aspects of that you found to be most valuable and why you think that helps move the dial? Maybe not instead of, but in addition to all your knowledge around intrinsic motivation, motivational interviewing, and stages of change, and some of the other elements that are core to you as a health and wellness coach.
Yes, I think the model is wonderful because it provides the structure for each coach that uses it to put best practice in place and to share the brilliant landscape that coaching can provide to a patient in need of orthopedic surgery, a patient in need of weight loss management, a patient in need of more connection and to get out of a loneliness cycle. It literally, every client patient can fit into that functional mental toughness structure, and the coach is a better coach. And in the end, the patient client receives that benefit and has more success.
And folks, some of you know what we're talking about because you've listened for a long time. We'll have a link to, I'll try to remember to put a link to one of the episodes that talks about FMT. The short version is it's a model with 4 elements. It's got a functional mental toughness bank, and it's just like your money bank. You put it in, you take it out, you want to be able to access it when you need it. And then there's 3 pieces that feed that and support one another. And it's thrive, prepare, and activate. Thrive is more lifestyle things we've been talking about. Prepare is the 2 weeks to 2 months leading up to whatever is important to you. And activate is in the moment. Is there, without going into detail, because they can reference the other episode, but Erin, is there 1 or 2 little tidbits from one of those pieces that you see coming up over and over as being maybe bubbling to the surface in this area?
I mean, each patient client is different, but I think within this model, you start in the thrive, you start in that rest, fuel, restore, connect. You see how that is ebbing and flowing in your, patient coach relationship, you move into prepare. You move into, are we going to look into GLP-1s and GIP pieces of weight loss support, or prepare if we're trying to get off those? So the whole piece allows adaptability to each relationship you're in a coaching way and in our team way.
Right.
And that's what's so beautiful about our multidisciplinary team. We ebb and flow with each other, and we're all learning these ways of working with the patient and the client that is so supportive to their well-being and success in long-lasting behavior change.
Yeah, well said. How do you measure the effectiveness of the lifestyle coaching in conjunction with the GLP-1 therapy? Are there metrics, Dr. Poz, that you look at, or outcomes that you focus on to say, okay, we're on the right track? Again, everyone's different, but are there some sort of key performance indicators in a business term that you would translate into the clinical elements that you're seeing or looking for?
Yeah, I think it's the biggest thing I see, when I first started this, I actually wasn't working with Erin as consistently. We didn't have a program yet. So I do have some patients that I saw for weight loss before that aren't using a wellness coach. And I think that the changes that I see consistently that I look for are really those sustainable changes that people, that I'm noticing in people, right? That they have changed their dietary patterns, that they have changed stress, they've changed sleep, like they're making those changes. And a lot of people, I think, that haven't worked with wellness coaches maybe aren't as consistent. I mean, there's only so much I can say, right? Like I, just like every single other physician, I can tell you what to do. That doesn't mean you're going to do it, right?
Totally.
And that's where the wellness coach comes in, is they are better. Like Erin's so much better about talking people through, like, okay, well, Sheri said you need to sleep 7 to 8.5 hours a night. Like, how are we going to make that work versus me just saying, do this and go home and do it. Right. So that when I see people actually making those changes, that's how I know that component is making a difference. Okay.
Yeah. Information does not equal application, everybody. Yeah. Otherwise, none of us would have jobs if that were the case. Two more questions. As you look forward, are you seeing any advancements, changes, tweaks, simplifications, reduced costs, anything that you're saying, oh, we can hardly wait until X, or we see this coming around the bend?
I think so. There are more and more medications coming out. That is a huge component, like more that are there. I mean, that look at even more satiety hormones, not just GLP, not just GIP. So I think that component is going to be even bigger. Whether that's for better or for worse for a period of time, not sure. I think it's going to make it more complicated before it makes it easier. But the more medications we have, hopefully, the more drive there is for competition between those medications. I think there's a huge push from the OMA with legislation of trying to get these medications covered, trying to help with the shortage component. Like those are things that I really see on the forefront that need to be taken care of. Is one, the insurances will cover these medications even if there isn't a shortage, and that there isn't a shortage on top of that. So people aren't going to these places, and I get why they are, right? I mean, paying for these medications out of pocket is pretty astronomical. And if you can get it at a third of the cost online, like, yeah, I totally get the drive for that. And if we can get rid of that, so it's safe for people, like that would be huge. And I think also the improvement of having more programs like ours that really address everything, that address those changes that people need to make on a sustainable change. And even with these medications, as you know, with weight loss, like there's always plateaus, right? People plateau. That is part of the human body. Like there's metabolic adaptation. Your body doesn't want to lose weight, whether you're taking these medications or not. It's going to try and prevent you from doing that. And it's going to metabolically adapt to do that. And even on these medications with our patients, they plateau. And if you're working with people to help you make subtle little changes, like are there things that you have changed? Are there things that we need to change? Do we need to look at something a little different? Like that, I think is huge for people for long-term sustainable and to get to that. Like maybe they lost 20 pounds, but they want to lose 40 pounds. Like where do I get to that component?
Makes sense. You've mentioned shortage several times throughout. What's the catalyst for that? What's the driver for that? What's the limiter? It seems like with there was no question when these were approved, the demand was going to be astronomical. So it's not like the drug companies are surprised. Oh my gosh, people like this. What a surprise. No, they knew this. It was guaranteed. So is there some resource that's limited? Is it, I just don't get the shortage, or is it self-imposed shortage to maintain the price points?
Yeah, that's a great question. I wish I could really answer that. But yeah, I mean, the cynic in me would say it's imposed, right? But there is a huge, think of the millions, like the demand out there right now is if you look at the statistics of overweight and obesity, like 40% of Americans are obese.
Yeah, it's what, 68%, 69% between those two categories?
Yeah, 70% are overweight. And by 2030, like 1 in 2 Americans will be obese.
Yeah.
So the numbers of that are huge. Huge. And if you look at insurance companies covering these medications at the cost of what they are right now, that's a lot.
Yeah.
I mean, that can bankrupt a lot.
Right.
Yeah.
Right. Last question's open-ended. What have I not teed up? You're dealing with this every single day. You're being asked all these different questions. What do we need to get out there to the listening audience so that they're aware of it, that they are not limited by Brad's ability to ask the right questions?
Yeah, I think one thing we didn't touch on was side effects of these medications.
Oh, good. Yes.
Side effects, and also, again, why you should be working with someone. They do exist. They're medications. GI stuff is the biggest component, and you need to work with someone to slowly titrate these medications up. But there are other big risks that come along with these medications. If you are someone that's on blood pressure medication and you go on these medications, you lose a ton of weight and someone's not watching that. You should be slowly titrating your blood pressure medication down. Same with, there have been reports of people that have been on thyroid medication that their autoimmune symptoms, their inflammation significantly got better, that all of a sudden their thyroid hormone levels changed and their thyroid medications needed to shift. So those are risks of things that actually can happen for people. We also, we touched on the fact of people not eating enough. That is a huge component as well. And there is definitely data about loss of muscle mass with these medications. Like any weight loss in general, you will have muscle mass loss. Like 1 out of every 4 pounds in general that you lose weight is going to be muscle. But with these medications, that may be double that. And so people need to recognize that, and you need to be working with someone to make sure that you are, 1, getting in protein, getting in the amount that you need. So from a nutrition standpoint, but also making sure you're strength training, doing the things that kind of prevent that, following along with a body composition scale to make sure as you're on these medications that you're not losing a tremendous amount of muscle mass through the process of all of it. So I think that the side effects are kind of downplayed, but they're there. It's with any medication, they're there. And you have to have that frank discussion with people. There is mental health risks with the medications. There are some reports of, especially in people who have a history of suicide or attempted suicide, you put on these medications, because it is working in the brain itself and that reward system and other components. You have to be cautious with people. So I think those are things that need to be out there too. People just and that's the tough thing when you're looking at I'm just going to go buy it off the internet. Just be careful.
Very careful.
So important. I just read that the average American is on 5 medications. I think it was 4 or 5. So you mentioned the thyroid, the blood pressure, folks. Anything that you're on, the body changes. It's specific to you in your current situation. You've got to make sure you're watching that crossover. Thank you for bringing that up. Erin, anything that popped into your head as we were kind of talking about any missing pieces here?
No, I love that she brought that up. It was on my head too. And you and I having the history of physical therapy, it's huge to help people understand those side effects and the things we can do in whether we're on GLP-1s, GIPs or not, to have longevity and health and well-being. And that lean body mass, that is our metabolic factory for the rest of our lives, and we have to take care of it.
Yeah, beautiful. You two, thanks so much, not just for joining us, but for what you're doing. It is so important. You're a lighthouse out there. Keep up the great work. We really appreciate it.
Yeah, thanks, Brad. Thanks for having us on.
Thanks for joining us for this episode of the Coaching Lab podcast. your source for engaging, evidence-based health, wellness, and performance insights. If you're a coach looking for best-in-class resources to build your toolbox and support your career, you'll find a wide range of options on our Institute site at catalystcoachinginstitute.com, including a new functional mental toughness and resilience specialist certification. And for those looking to pursue certification as a health and wellness coach, we're pleased to announce that Fortune magazine rated Catalyst Coaching Institute the nation's top program, and our schedule for upcoming cohorts is available on the same site, catalystcoachinginstitute.com. And of course, reach out to us anytime to discuss your specific questions. Results at catalystcoachinginstitute.com. And now it's time to be a catalyst. This is Dr. Brad Cooper of Catalyst Coaching. I'll speak with you soon on another episode of the Coaching Lab podcast, or maybe over on the YouTube coaching channel.